The International Conference on AIDS and Sexually Transmitted Infections in Africa, ICASA 16, was held in Addis Ababa from December 4th through the 8th, 2011, with a theme of Own, Scale Up, and Sustain.
I would like you all welcome to Ethiopia for the 16th International Conference on AIDS and Sexually Transmitted Infections in Africa.
Although the main objective of the conference is to eradicate HIV, previous editions of ICASA have not been too strong when it comes to disability inclusion, both in terms of visibility and accessibility. Despite the significant intersection between HIV and disability, persons with disabilities have been largely ignored within national responses to HIV and existing HIV prevention, care, treatment, and support programs. This increases the vulnerability of this category of individuals to HIV and AIDS. In June 2011, the World Bank and the World Health Organization, WHO, launched the first World Report on Disability. The report estimates that 15% of the world's population lives with disability, and among them, 80% live in resource-poor settings, where they face difficulties in accessing the most basic services to accommodate their needs. Handicap International and the partners of the International Disability and Development Consortium, IDDC, were involved in this International AIDS Conference to address the different needs, desires, challenges, and rights of persons with disabilities. Apart from it, Handicap International and its collaborative partners, such as HERD, Sightsavers, and DPOD, drew attention to the intersectionality between HIV and AIDS and disability.
You may wonder why Handicap International is so keen in the overall ICASA preparation. ICASA preparation is one of the objectives to be attained under this project, HIV and Disability Project. That's why we were so much involved in that. The other objective that we are trying to achieve is the awareness creation. Awareness creation not in terms of only HIV, but in terms of the intersectionality between HIV and disability. And it was one of the sessions which we have managed to discuss during the conference as well. The project that I am running here focuses mainly on creating awareness in accessible format. So that we have developed different ICA and BCC materials in collaboration with persons with disabilities. This is something that has to be underlined.
In ICASA 2011, 2 non-abstract driven sessions on HIV and disability were organized with key speakers from UN AIDS, research institutions, disabled people's organizations, Handicap International, and women with disabilities living with HIV. Handicap International has been heavily involved in the preparation of the ICASA 2011 conference. To start with, the Director General of Handicap International France was nominated as one of the International Steering Committee members. During initial meetings, it was not easy to convince community members of disability inclusion. Most of them were not interested about the issue of disability. In order to address this, strong negotiation between the ICASA Secretariat Office and Handicap International was deployed. As a result, a Disability Networking Zone, DNZ, and 2 non-abstract driven sessions on HIV and disability in the leadership and community programs were approved, as well as accessibility features put in place.
Initially, the issue of disability in all forms was not well taken by the International Steering Committee. So we had to do a kind of brainstorming in all the sessions to make sure that disability is mainstreamed in ICASA conference. So we have had a bitter struggle to make people aware about the importance of mainstreaming disability into the conference, and also to make them aware that issue of disability is not something negligible, something that you can't forget.
2 days prior to the official opening of ICASA, a strategic meeting was organized among Handicap International's Disabled People's Organization partners. The objective of the meeting was to strategize how to raise the issue of disability in the different sessions at ICASA, as well as reflect on the lessons learned from past ICASAs to improve the accessibility of ICASA in Addis Ababa. For the 16th ICASA conference, many persons with disabilities from different countries attended the conference. Moreover, international donors, partners, and persons with disabilities activists came from different countries. In the community village opening ceremony, there were officials from UNAIDS and community representatives. Disability Networking Zone was one of the zones hosted by the community village. During the opening ceremony, these officials addressed the importance of community zones in the response to HIV. Handicap International and IDDC members such as HERD, Sightsavers, and DPOD organized a full week-long disability networking zone whereby persons with disabilities and non-disabled persons from different countries of sub-Saharan Africa made presentations and debated on HIV and disability. Motivation of the Disability Networking Zone was fantastic. It was one of the busiest zones in the community village. The theme of the zone was Sustainable Disability Inclusive HIV Response for Universal Access. To address this theme, there were presentations, roundtable discussions, skills-building workshops, and moderated sessions that addressed various perspectives of disability and HIV by presenters from South Africa, Ethiopia, Uganda, Sudan, Kenya, Burundi, Zimbabwe, Senegal, Mali, and Cameroon. Furthermore, films were screened to create awareness on the intersectionality between HIV and disability. At the community village performance stage, there was a slogan entitled, "We Too Can Dance," and during the dance ceremony, we saw the amazing talents of persons with disabilities. The deaf can follow the beat of the music. Physically disabled people can perform following the rhythm of Amharic songs. When provided with the opportunity to express their artistic talents, persons with disabilities can perform as beautifully as anyone else.
I want to thank Handicap International, who have supported a number of PWDs, especially a person with disabilities in Ethiopia. What we have seen, in fact, it was a good example that disability is not inability. So, especially the show, it was really educative. We learned a lot, and I think we'll take the information back to our homes.
Although HIV and disability are closely interrelated, persons with disabilities are often forgotten from HIV service providers due to the belief that they are sexually inactive, lack of accessible health facilities, lack of education material adapted to the different needs of persons with different impairments, lack of knowledge of health services providers on disability issues, and lack of inclusive policies and guidelines in HIV and AIDS, to name a few. More than often, HIV prevention, treatment, care, and support services are not designed to respond to the needs of women, men, youth, and children with different impairments. Moreover, the creation of disability through the emergence of HIV-related impairments among people living with HIV are often overlooked by HIV mainstream providers.
For one most reason, it's that disability and disabled people are completely forgotten on any kind of strategies. I mean strategies for prevention, for information, access to services, access to economic and social inclusion.
Persons with physical, sensory, intellectual, and mental impairments are at high risk of HIV infection due due to insufficient access to HIV prevention information, lack of access to adapted services, vulnerability to sexual violence. Women and girls with disabilities are particularly at risk, and their limited access to treatment services. All these factors heighten their risks and vulnerabilities to HIV and other sexually transmitted infections overall.
I don't think HIV programming is inclusive of disability as yet. There are actually two dimensions missing. There's one side that people with disabilities are at risk to be infected with HIV, as well as when they're infected having access to treatment. And there is an even bigger area of people that live with HIV that are now having access to treatment, that are developing disabilities because of HIV, its treatment, or its opportunistic diseases associated with it.
ያለው ትልቁ ቻሌንጅ ቀደም እንደተጠቀሰው በያካል ጉዳቱ
When we see HIV and disability, the challenges vary from one kind of impairment to the other. For instance, during HIV testing and counseling, the deaf are not able to keep their secret because there must be a sign language interpreter. Although it should be a secret, it's difficult to maintain the result of deaf within them. Hence, there should be health professionals who knows a sign language. To fill this gap, my organization trained 30 health professionals in sign language. On the other hand, blind people can't differentiate ART because it's not done to differentiate by them. Hence, they compel to ask the support of others. Besides, most of the health centers have no ramps. All in all, things are much more difficult with persons with disabilities than others.
These challenges and barriers are results of obvious gaps in laws, policies, and guidelines related to the HIV response. Persons with disabilities are often not part of the decision-making process and usually do not participate in policy-making from inception. Unless persons with disabilities are actively given the opportunity to engage in these dynamics, their rights will not be fully met.
We are completely ignorant because we've been left out. Now we're saying nothing for us without us. We are saying we have to be part of you as you make decisions. Do not just gather yourselves on the corner and make decisions on us. We have to be together so that we show you how we feel it, how we should want things to be like.
Disability inclusion in all sectors should adopt the principles of universal design and reasonable accommodation cross impairments-wise.
The question of accessibility is not only the physical accessibility, it's in mind. And we are used to say to doctors, to surgeons, to all people working in the health services, are you open enough to disabled people?
HIV and AIDS knows no boundaries. It knocks at the door of everyone, whether he or she is disabled or non-disabled. As we observe, this is the case of many disabled people in Africa. HIV and AIDS doesn't discriminate, even when policymakers and the community do.
Discrimination can be addressed through legal frameworks. So we need to work and make sure that there are legal frameworks which prevent discrimination. And of course legal frameworks need to be implemented. Stigma is often due to cultural issues and is much more difficult to address for so many of the key marginalized populations. So there we need to get both abled and disabled people talking together so that they both can understand each other and make a difference.
I am a member of steering committee for African campaign to ban the discrimination about disabled people in programs in HIV in different countries in Africa.
Advocacy and partnership are also important. Hence, ICASA 2011 was an opportunity for persons with disabilities alongside disability activists and stakeholders to advocate for disability inclusion in HIV programming and policies. There was a silent protest as an advocacy strategy at the end of the 5 days conference. During the silent protest, persons with disabilities and other stakeholders carried placards displaying various issues relating to marginalization of persons with disabilities in the HIV response. The peaceful protest, held at the main entrance of the venue of the main closing plenary session of the conference, attracted the attention of both international and local media, as well as international and national ICASA participants. Is the 16th ICASA in Addis Ababa fully accessible to persons with disabilities and address disability inclusion?
During the preparation of the venue, utmost care has been taken to address the needs and interests of people with disability. Of course, the Millennium Hall, which we later on developed into full-blown conference center, did not take into account from the beginning the needs of the disabled. But when we went to prepare this place for the conference, we first of all imported mobile toilets for people with disability and installed in 3 places in the conference.
So we've worked very hard as part of, as a member of the local organizing committee to make sure that disability was on the agenda, and I think you'll agree with me that we have at least 3 sessions, 3 major sessions in which disability is the core of the program. We have also tried, maybe not entirely successfully, to make sure that this conference is accessible, and it's the first time in Africa that that's really happened. We've seen sign language in many of the sessions. We've seen some ramps, but not enough, like in the last room. But I think you'll agree with me that there has been an effort, and there really is encouraging progress.
Out of the 14 conference rooms, 10 of them had ramps.
The Handicap International has been working with us for some time while we were organizing or working towards this conference, and I believe we have achieved a lot, and we have accommodated the needs of people with disabilities and to make them capable to attend this conference.
Very great thanks to the organizers of ICASA conference, because I've been to ICASA 2008. And indeed, it was the first ICASA that was starting to include disability. We had some steps more there, but I think this time the inclusion of disability has been to a great extent. We have many rooms that are accessible to persons with disabilities.
If we compare it with the one in Dakar, Senegal, in 2008, yeah, there are some improvements. But at the same time, there still needs, room for more improvement in the future ICASAs. We appreciate the fact that we were able to achieve some level of accessibility, but it was not perfect. What is left is, for example, we need to be more visible. We want ICASA organizing committees in the future to actually allow participation of persons with disabilities in the steering committees, and to also make sure that everything that has to do with persons with disabilities, that will make it accessible to them.
What has to be done for future international AIDS conferences? The involvement of disabled people's organizations as well as disability-led organizations such as Handicap International and HERD will be extremely important for the coming ICASA in Durban. In the meantime, more research and studies need to be undertaken to increase the knowledge base so that these findings can be presented and disseminated during the next ICASA. With more evidence, one can argue more effectively for the inclusion of persons with disabilities in HIV policies and programming.
You only know, when you know how many deaf people you've got. So you do need that kind of data. You also need to know what kind of disabilities are people living with HIV actually getting. We do know a little bit about mental health, we do know a little bit about neurocognitive disorders, but we know very little bit about other things, like other impairments, like blindness that is related to HIV. We don't know how many of our people that are on treatment are going to develop a disability. Now, if I don't know that, I'm not planning how many physiotherapists, for instance, I need in a hospital setting. Because I don't know that it is 80% of all of them, or maybe it's 60%. I cannot tell you that, but we do need that kind of data.
Cohesion and integrated voice matters. Solidarity or fraternity among persons with disabilities also makes a difference. Those who have different impairments can take the leadership by standing together. Moreover, the policymakers should know that these are not special needs, but rather recognize them as different needs. It is a question of addressing disabled people's rights. The ratification of the UN Convention on the Rights of Persons with Disabilities is not enough. Immediate action must also follow. Furthermore, accountability, transparency, and enforcement of the law are also essential steps towards equal exercise of persons with disabilities' rights. Hence, everyone must play his or her own role in addressing this issue, from decision makers to service providers to community members and to families and individuals.
All stakeholders have a role to play.